I am Dr. Biswajit, presenting my case study, thyroid function status in children with congestive heart failure. Introduction. Cardiovascular system is a known target for the thyroid hormones exerted by various genomic and non-genomic factors, as shown in multiple adult studies and some limited studies done in pediatric age group. Sick-Euthyroid syndrome is postulated as a state of adaptive response of the body in acute stressful condition by lowering the metabolic state to conserve energy. As we can see in the right side picture, the prolonged or severe critical illness that leads to HP axis suppression that causes T3 decrease in T3 T4 as well as TSS decrease. There is increase in RT3 also. B-type natriuretic peptide is a neurohormone that is secreted from the ventricles in response to the stress hormones that causes vasodilation, natriuresis and diuresis. The studies also show that levels of BNP significantly increase in congenital heart disease, congestive heart failure and cardiomyopathies. However, the role of the thyroxine replacement is controversial, done in studies in post-op cases of CPP surgeries, and meta-analysis shows that decreased requirement of inotrope support and ICU stay in those groups. The objectives. Primary objective was to evaluate the proportion of children having sick-Euthyroid illness with congenital heart disease with congestive heart failure, and secondary objective was to correlate the thyroid hormone levels with the BNP level and compare the duration of hospitalization in hospitalized children with or without sick-Euthyroid illness. Methodology. It was a cross-sectional study done in children with 6 weeks to 16 months of age group who are pre-diagnosed with congenital heart disease, now presenting with congestive heart failure. The exclusion criteria were children with previous known thyroid abnormalities or known syndromes like Downs and Turner syndrome, or children with previous acquired cardiomyopathies. Total 55 children are included. Sample size was calculated using a previous study done in adults having heart failure with a proportion of sick-Euthyroid syndrome 24.5% using this formula with a confidence interval of 95% and Z value of 1.96 and 10% of margin of error. After taking the consent from the patient and patient's attendant and getting the clearance from IEC, study was started. Demographic data and previous treatment record was collected that and congestive heart failure was assessed clinically initially, and after stabilization period sampling was done for thyroid hormones and BNP levels, and serum sample was analyzed using a CLIA method. Sick-Euthyroid syndrome is defined as type 1 and type 2. In type 1 we define it as low FT3 level with or with normal or low TSS level and normal T4 level, and in type 2 both FT3 and FT4 decreases with normal or low TSS level. Outcomes to see the proportion of sick-Euthyroid illness among the said included group, and secondary outcome to see the correlation between the thyroid hormones and the BNP level, and to see the duration of hospitalization as well as also mortality among the sick or non-sick-Euthyroid group. Data were compiled using MS Excel software and analysis was done using SPSS 250 software. Median levels and intercostal lesions were estimated for thyroid hormones and BNP levels and compared using Mann-Whitney test. Proportion for those with and without sick-Euthyroid illness compared by chi-square test, odds ratio calculated for the risk. Correlation of thyroid hormone levels with duration of hospitalization done using Pearson correlation coefficient. ROC curve was plotted for predicting SES. P-value of less than 0.05 was taken as significant. Total 98 children were taken, out of them 43 were excluded. Among the 50 children with median age of 4.75 months, 85.45% children had acyanotic heart disease and 14.55 had cyanotic heart disease. Among the cyanotic heart disease, BST was the most common, and among the CCST, it was transposition of great artery was the most common. This table shows the median and IQ level of the lab parameters like FT3, FT4, TSS and BNP. We can see the BNP level significantly raised. Out of the total 55 enrolled, among the 32 were non-sick-Euthyroid group and 23 were sick-Euthyroid. Among the non-sick-Euthyroid group, 29 were discharged and 3 were expired. And among the sick-Euthyroid group, the overall mortality was 5 and overall discharge was 18. And 10% children having sick-Euthyroid having odds of 2.32 times mortality than the non-sick-Euthyroid group. This table shows the comparison between the non-sick-Euthyroid and sick-Euthyroid group, taking parameters like age, thyroid hormones, BNP, duration of stay, AST, ALT level. We can see there is a significant low level of FT3 and FT4 level in sick-Euthyroid syndrome. Also, there is increase in BNP that the p-value is not that much significant, that increase in sick-Euthyroid group. This slide and the next slide shows the correlation between the BNP and various thyroid hormones. We can see that there is a negative correlation among the three FT3, FT4, and TSH with the BNP. This graph shows the clustering the low TSH level as you go up higher up the BNP level. Similar effect in seen also in T3. The left side box shows that the median BNP level is higher for the CQ thyroid group, and the ROC curve plotted that shows that the area under the curve having 0.718 with a cutoff of BNP value 890, having sensitivity sensitive to 95% sensitivity and 70% specificity for the CQ thyroid syndrome. The limitations of our study, as we took a limited number of patients, so we analyzed using the subgroup analysis. It was a cross-sectional study, so we couldn't follow up the patients later. So time to resolution of CQ thyroid syndrome was not measured, and reverse T3 levels are not available at present. Conclusion, CQ thyroid syndrome was seen in a significant proportion of children, that is 41.8% children having congenital heart disease with congestive heart failure, and the presence of CQ thyroid syndrome adversely affected the disease outcomes in terms of mortality as well as the discharge rate also. Serum BNP levels can be used for monitoring of clinical course and outcomes, and the role of levothyroxine supplementation in pediatric congenital heart failure needs to be further evaluation. Thank you.
SES, the presence gives more prediction regarding poor outcome than say ejection fraction, DNP.
Sir, actually we took into consideration, it is a thesis topic of mine. We did the ejection fraction of the child also, but we didn't find the correlation, because we find the ejection fraction came to be normal for all the children that we included. That may be due to because we did the ejection fraction after stabilization of the child, so that may bias. So we didn't include in those slides, but it's in our main study.
From your literature review, what is the role of, I mean, is there any role of replacement of thyroxine in these sick children?
Ma'am, there is not much study that supports the role of thyroxine in specifically in this group, but there are some studies that done in children having congenital heart disease. Those undergone surgeries, like I showed on meta-analysis, they showed that thyroxine as such there is no role in that is predicting the outcome, but they showed that it decreases the inotropic support and the duration of ICU stay. But not much studied on in the study that I took.
Was there any difference in the infection rate in the SES group and non-SES group?
Sir, actually we didn't include that in our study. We took CHF,
what was the precipitating cause for CHF?
Yes, sir, but in that study, it's a cross-sectional study that we took the sample at spot and we evaluated the patient at spot only, but we couldn't follow that child.
What sir is asking is, could infection be the precipitating factor for CHF?
Yes, sir. Yes, sir.
As a background?
Most commonly, congenital heart disease children have viral pneumonia associated. That sometimes
yes. So the severity of that pneumonia may be affecting your mortality, not the
yes,
CHF itself.
Yes, sir. That can affect, but we have not shown in this study.
Because SES is a marker of other
yes,
conditions. It's not a condition by itself.